This topical spray comes in different brands, each with its own specific uses. Some are designed to alleviate minor muscle and joint pain, like arthritis, backache, and sprains. Others are formulated to relieve itching and skin irritation from sunburn, insect bites, or minor scrapes. The active ingredient, menthol, works as a counterirritant, creating a cooling and warming sensation on the skin to help alleviate discomfort. For best results, apply as directed for targeted relief. If you are using this medication without a prescription, make sure to carefully read and follow all the directions on the product package. If you have any questions, consult your pharmacist. If it's prescribed by your doctor, use it as directed. This medication is meant to be used only on the skin. Apply it to the affected area no more than 3 to 4 times a day. If you are using the cream, gel, or liquid, rub it in gently and thoroughly. Some liquid forms of this medication should be shaken before use. Let the medicine dry completely before letting anyone else touch the area. After applying, wash your hands well unless you are using this medication to treat the hands. Avoid getting it in your eyes, nose, or mouth. If it does get into those areas, flush with plenty of water. Do not use on serious burns or deep wounds, and avoid bandaging or tightly wrapping the affected area. Heat can increase the risk of side effects, so don't apply this medication right before, during, or after activities that increase skin temperature. Wait until your skin has cooled before applying. Also, avoid using a sun lamp, tanning bed, hot water bottle, or heating pad on the treated area. Check the ingredients on the label, as the manufacturer may have changed them. Also, products with similar names may have different ingredients meant for different purposes. Read the label carefully to make sure you have the right product for you. Finally, if your condition lasts for more than 7 days, gets worse, or keeps returning, make sure to tell your doctor. And if you think you may have a serious medical problem, seek medical help right away. If you experience redness, warmth, or irritation at the application site, it's important to let your doctor or pharmacist know. However, many people using this medication do not have serious side effects. If you notice blistering or swelling at the application site, increased or unusual pain, or any signs of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing, it's important to stop using this medication and seek medical help right away. It's also important to contact your doctor or pharmacist if you notice any other effects not listed above. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. It is important to talk to your doctor or pharmacist before using icy hot, menthol, 16% topical spray if you are allergic to menthol or have any other allergies. This product may contain inactive ingredients that could cause allergic reactions or other problems, so it's best to consult with your pharmacist for more details. Before using this medication, make sure to inform your doctor or pharmacist about your medical history. If you are planning to have surgery, it's important to let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, icy hot, menthol, 16% topical spray should only be used when clearly needed. It's crucial to discuss the risks and benefits with your doctor before using this medication during pregnancy. Additionally, it's unknown if this medication passes into breast milk, so it's important to consult your doctor before using it while breastfeeding. As always, talk to your healthcare provider for personalized medical advice. When using icy hot, menthol, 16% topical spray dermatological irritants-counter-irritant formulations, it's important to be aware of potential drug interactions. These interactions could affect how your medications work or increase your risk for serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Before making any changes to your medication dosage, always seek your doctor's approval. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms such as fainting or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. U.S. residents can reach their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center for assistance. Make sure to use icy hot, menthol, 16% topical spray as directed by your doctor or as indicated on the product label. It is important to follow the dosage instructions carefully to achieve the best results. This medication is used to provide relief from muscle and joint pain, as well as minor arthritis. It works by creating a cooling and then warming sensation that helps to distract from the pain. This spray is for external use only. Make sure to wash your hands after applying and avoid getting it in your eyes, nose, or mouth. Apply the spray to the affected area no more than 3 to 4 times a day. Do not use it on broken, damaged, or irritated skin. Be cautious when using it on children, and always consult a doctor before using it on a child under 12 years old. It is best to apply the spray at the first sign of pain for the most effective relief. However, do not use it right before or right after activities that increase the risk of skin irritation, such as swimming, bathing, or sun exposure. Always wait at least 60 minutes before applying it. If you forget to use icy hot, menthol, 16% topical spray on your regular schedule, use it as soon as you remember. If it's close to the time for your next dose, skip the missed one and use the next dose at the regular time. Do not use double the amount to make up for the missed dose. It's important to store icy hot, menthol, 16% topical spray at room temperature, but make sure to check the product package for specific storage instructions. Keep this medication away from children and pets, and do not flush it down the toilet or pour it into a drain unless instructed to do so. When it's expired or no longer needed, make sure to properly discard it by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.